I'm very excited about taking up my new role as HOD for DCFS. Of course, as you know, and most people do know, that that's where I started my career as a social worker. So I'm very happy to be taking on this new chapter in my professional journey. So my key responsibilities are the strategic oversight of the department, the daily operations, ensuring that we have the necessary structures and frameworks in place to guide us at best practice in terms of social work services and the other key services that we provide to the community. I'm also responsible for our budget and, of course, have oversight of some HR matters as well. So basically it's the day-to-day runnings with the assistance of the senior management team and the deputy director in regards to oversight of all those pieces. I'm also charged with ensuring compliance of the various pieces of legislation that the department operates under, such as the Children's Law, the Youth Justice Law, the Health Insurance Law, and the Adoptions Law. So some key pieces, and we're also looking at the Older Persons Law when it comes time to do some reviews and amendments to that to ensure that responsibilities for the oversight of elderly in terms of matters of abuse and care, that we fall under the legislation that gives us the teeth to work with those persons. Let me give you some historical background in terms of social work services in the Cayman Islands. So over the years, we've gone through various changes in structure and service delivery, but one of the things that we have always done as a department is practice generic social work, and that means that social workers had a very general caseload, so there was very little specialization in certain subject areas. Over the past few years, in 2012, when the Children's Law commenced, we embarked on the journey of restructuring the services and establishing teams. What we have done again over the last year plus is to again review those teams and even drill down deeper to having a more specialized focus. So we now have a team that focuses on child protection, which is incorporated in the MASH unit, which is the multi-agency safeguarding hub. We have our staff who are there working alongside police, co-located there, and HSA. We work closely with education services in regards to the investigations and assessments of all child protection referrals that come in through our doors. Then we have our adoption and foster care unit, and as that also says, it deals with matters of adoption. So we're the agency responsible for processing applications, conducting the home studies, supervision orders, and attending to court when matters are being brought before the court for adoption orders to be made. In regards to foster care, of course, that is oversight of our foster care unit that deals with children who are brought into state care. So we work closely with NCVO, we work closely with Keys Foundation, and then we have our community partners, so foster parents who are in the community. And again, we do provide training, monitoring, and supervision for the children who are in care, but also the training piece for the foster parents who volunteer to be in the program. We have our youth services team. Again, that team is responsible for our youth justice matters. So children who are entering the justice system. We have workers who assist in preparing reports, monitoring and providing supervision if they come under various orders such as community service orders, probation orders, youth rehabilitation orders. One of the things that we are embarking on is to take a more preventative approach with our young people who may encounter coming in contact with the law. We want to create a more diversion rather than bringing them into the system, because sometimes you bring persons into the system very soon. There are labels attached to them. They feel that there is no other alternative, and they take the road down into the adult justice system. So it's looking at a preventative approach in partnering with the relevant agencies to establish a working program that will address some of these matters for our young people. So we're very excited about developing that team. Of course, we are partnering with established agencies such as Department of Community Rehabilitation. We're looking at partnering with NDC. Of course, the police will be key partners, education services, they will be key partners as well. And we can't leave out the courts because, again, conversation will start there with them as to how we develop and who is suitable to enter into the diversion program that we're working towards. So that's youth services. Then we have our family services team, and that is focused on addressing private law matters as well as any matters coming in for family intervention, individual issues, but more so with the focus on providing services to the courts for matters of custody, access, supervision. Unfortunately, the reality in the Cayman Islands, and I know some time ago, statistics showed that we had one of the highest divorce rates in the region, possibly the world. And of course, the focus is to, whilst those relationships end and their children involved, the key focus is to ensure that whatever decisions are made by the court are in the best interest of the children. And children deserve right to family, right to parents. And it's about bringing parents together to come up with a co-parenting strategy that will be in the best interest of their children. We also provide mediation services to some of those matters that come across our desk in the department. And again, we provide supervision of access visits, something that we're seeing growing in number. Whilst we appreciate the courts requesting that, it is one of the challenges that we face in terms of human capital to be able to have social workers who are required on weekends, public holidays, to supervise access visits for families that the court have ordered. We have to be mindful that our social workers too have families and children that they have to take care of. But that being said, the staff at DCFS, they're very dedicated, and we're creative in how we address these issues. Hopefully going forward, we have some ideas as to how we can assist and accommodate the request for the supervised access visits, possibly partnering with the justices of the peace. We started that conversation some time ago, so we're looking forward to picking it back up and seeing how they may assist us in providing supervised access visits as well. Okay. We also have our elderly services team. So I know it's a mouthful and it's a lot going on at DCFS. Yes. Never a dull moment, never a dull moment. Elderly services team. This is our newly formed team, and we are really excited about the programs that are going to be developed that are coming out of our team. That team, I would say, and I'm giving a shout out to them, that last month was Older Persons Month, and I must say that we had a successful month long of activities. I know GIS captured a lot, and thanks to you guys again, a lot of the events that took place, and the feedback was extremely positive from our older persons. So again, whilst we celebrate October as our Older Persons Month, one of the key things that we're looking into is establishing a regular schedule of activities throughout the year for our older persons, whether they be social activities, educational activities, having discussions with employers about, how do we utilize our older persons who are still employable, who still have skills, looking at programs that include elderly persons who provide mentorship in the schools, who continue to share the breadth of knowledge that they have about our Caymanian heritage, about our work ethic, about our Cayman kind. So keeping our heritage alive through storytelling, through engagement. So we're looking at engaging with education services, about developing such programs. And again, it's a public-private partnership with some of the programs that we want to enhance and develop, whilst keeping Older Persons Month as the highlight of celebrating our seniors, but keeping signature events for those months. Then we have our Cayman BRAC team. And our Cayman BRAC team, they're not so specialized, but we have a supervisor, a social worker there. And then we have our community development team, who one member of staff is there. And we also have our adult special needs team. What I forgot to share is that our adult special needs program also falls under falls under our elderly services team. And again, it's, you know, keeping the synergies intact that we have, you know, the flow of services. And for persons who don't know, we have, and I always have to count, we have 1, 2, 3, 4, 5. Well, one is coming online, but we have 5 facilities in which we provide services for our elderly persons who are unable to remain in their homes. And we also have a facility that is also used for young adults with mental and physical challenges as well. We are in the process of renovating and bringing online a facility for our children who have to be brought into care, who have medical and physical challenges as well. So we're looking forward to getting that facility up and running in the new year. I'm sure we're probably going to be in the media more talking about how we can partner with the public in terms of donations and sponsorships to make sure that the children have a comfortable and secure place to call home. So again, that is DCFS in a nutshell. I did touch on community development, and that's also a strong program that we have and that we're looking forward to doing some revision of that, strengthening that program as well, to ensure that we are meeting the needs of the community and that connection is there. For community development, one of the things that we want to do is to educate the public on the link, because community development is the bridge between community and government, and being able to do community assessment needs, seeing what the need is in the communities, getting feedback from the communities on how we can best partner and secure whatever resources that we need to uplift and enhance community involvement. The reality is, I don't think any organization will ever be up to maximum manpower. To be honest, I would like to say that we don't need any more staff at DCFS, but the reality is that with the increase of social issues, social challenges, unfortunately, we're going to see a need. I was sharing with someone the other day, I have a utopic vision that we are able to eliminate social issues in the Cayman Islands, such as domestic violence, child abuse, elderly abuse. And if I don't have that goal, I don't think I would stay in this profession very long. So that's what keeps me going, is that someday we're going to get there. And if we don't have a goal to reach, then what's the point? But that being said, challenges for the department. At this point, we have been quite fortunate to receive funding for the recruitment of additional staff, both in our adult special needs program as well as our social work staff. So we're moving towards at least being up to what I would want to say minimum capacity in terms of human resources. But that being said, I think we have to be fair and be creative with the resources that we have. And again, it's not about the department trying to do everything and tackle every issue that comes through our door. We have partner agencies such as Department of Counseling Services, National Drug Council. We have private partnerships with Feed Our Future, Big Brother, Big Sister, YMCA. The list goes on in terms of our private and public partnerships. We work closely with our sister agency, the Needs Assessment Unit, and of course the support from our Ministry of Community Affairs. In terms of identified challenges at this point, one of the things that we currently face, and it has been an issue for some time, is being able to increase our pool of foster carers in the community. We have done active recruitment drives. Persons are always keen to ask questions, to sign up on the register, but when it comes time to actually follow through, I know people have some difficulties. And again, it's for the department to do more promos and public education as to what it is that we need when we're looking for foster parents. So I'm going to take this opportunity to put a plug in there. We're going to be starting our recruitment drive again 2019, and we want foster parents. They don't have to be signed up. It's not a long term. If you're not comfortable with giving long term care to a child or children, we have respite, emergency, medium to long term, and we can work with you in terms of where you see best fit in terms of offering that service. So we're going to be out and we're going to be visible, so you'll be seeing us again in the supermarkets, doing presentation at our service club meetings, and businesses as well. In regards to ongoing training for our staff, again, we have to ensure that our staff are current in terms of best practice and standards, because we're dealing with people's lives. We're dealing with vulnerable people in situations where, you know, if we were to share some of the stories, people would say, this is happening in the Cayman Islands. Well, unfortunately, yes, it's happening in the Cayman Islands. And in order for us to be more proactive, as well as being able to address the issues when they do present, we have to ensure that our staff are properly trained and skilled up. So again, ensuring that we have a good training schedule developed for our staff, so we can be able to deliver the gold standard of social work practices in the Cayman Islands. Challenge in regards to the perception of the department. So of course, you normally hear on the street, well, I went to the department and they got all my business all over the street. We understand small community, but one thing I would say is that social workers and employees of the Department of Children and Family Services they have to maintain a standard of professionalism when it comes to confidentiality and privacy. As social workers, we abide by a code of ethics, and that code of ethics speaks to ensuring that we maintain confidentiality and privacy of our clients. And oftentimes when stories come out in the public that, you know, DCFS hasn't done this, DCFS did that, we're not able to respond. It's not because we have done something wrong, but we respect the privacy of our clients, and we cannot rebut and say, well, this and this is what we did, or this and this is what the client didn't do. No, we cannot do that. So oftentimes our silence may be deemed as, well, not too sure what they're doing down there. But no, it is that we are obligated to follow our code of conduct, and that is that we have to maintain clients' confidentiality. So perception of what DCFS does, who we are as an organization, is one of the things that I'm looking forward to in terms of just putting us out there. I say that the work we do is not very glamorous, but we have qualified staff, and I think staff need to be put out there in the forefront, and the services we provide to the community so that people can understand that we are here to serve. We're here to partner with you. We're here to assist, and that is what we want to do. We have a list of partnerships outside of government. We have nonprofits, we have businesses, and especially around this time of year, the partnership really increases. And again, I'll take this opportunity to say thank you to all our donors and sponsors for our various annual events, for Child Month, for Older Persons Month, but of course for summertime when donations come in for school supplies, but also at Christmas time. The Cayman kind spirit really comes out during this time of year. And I encourage persons, however you can, assist those less fortunate in the community. Even if it's not through DCFS, I do encourage you to, brighten somebody's day. And it's not always that persons can give financially or goods, but we do have conversations about persons who are willing to volunteer in our various programs. Again, we have to do a thorough background check, because we can't just accept any and everybody, again, because of the clients that we serve. But we are always open for that private-public partnership for persons organizations, individuals who want to come in and just, have a chat with us to find out how they can help us. One of the key things that I do want to say to our community is that we have strayed from, and as cliches as it sounds, but we have strayed from being the village that takes care of our children. And I'm going to add to that is that we have strayed from the village that takes care of our children, our elderly, and our vulnerable persons. And I believe that we need to revisit and come back to those grassroots values and morals in terms of looking out for our neighbors. The department, government cannot fight child abuse, elderly abuse, the discrimination of our vulnerable persons alone. It is a partnership. And if we are to tackle these issues, it has to be done jointly. So it is with encouragement, again, every little bit counts. Every little bit counts. It's interesting, we just concluded a 3-day, half-day workshop with senior management, and this was one of the questions that we tackled. The vision that we have for the department is that the department, and we're putting a tight timeline on ourselves, but we would say in the next 5 years, the Department of Children and Family Services Cayman Islands should be setting the gold standard for child safeguarding in the region. We want to be the department that our BOTs and our sister islands come to model what we're doing when it comes to social work practices, working with our elderly, working with our children, working with our vulnerable people, that we have set the gold standard here in the Cayman Islands. When I leave the department, I want to know that I've left a department that is functioning at a level, again, that other territories, other countries are coming here to model our best practices, our policies that we have in place, the systems that we have engaged in. I want it to be where I am leaving a department that there'll be no question as to who will fill that seat, because the pool is going to be so tight that they're going to be confused. So ensuring that succession planning is indeed in place. Persons are trained and skilled up. It should be as though I have never left the chair, but with some enhancement. So again, it's ensuring that succession planning is in place for a capable Caymanian to take the reins, to ensure that we are setting a high standard of social work practice in the Cayman Islands and in the region and globally. as well as, again, I go back to my utopic approach, in that we would have decreased the number of allegations, suspicions, referrals of child abuse in the Cayman Islands, that we will be geared towards more preventative programs, putting funding where prevention is key, and we're not listening or hearing about harsh incidents of child sexual abuse, child physical abuse, neglect, as well as the elderly.